Okay, guys, good morning. Again, I'm Michelle Kapp, and I am hosting today's webinar with Jeff Nasser, the Regional Vice President at Aetna. I appreciate you guys taking time out of your day to learn a little bit more about this exciting new product from Aetna. We are very excited to be working with them and getting this off the ground running. Our brokers I know that I've spoken with are super excited, so I can't wait to hear more about it. Just so you know, all phones are muted. If you have any questions, please type them in the chat window. After the presentation, we will have a question and answer period. So you can ask me or Jeff any questions that you may have at the end of the presentation. This presentation will be recorded for reference later if you would like a copy as well. Just a couple of things before we get started. We are really excited here at Cornerstone. Our Medicare Center, which many of you are already utilizing, we're offering some new ways to enroll your clients via text. We'll have some information about that coming up next week in other webinars, but we are super excited. This will make it much easier to enroll your clients during AEP out of the office. Our annual Senior Roadshow, which we all look forward to so much every year, will be done just a little bit different this time. We're doing everything virtual, so we will still be providing all the information that we give you guys every year. We want to keep you up to date about all changes and get you ready for AEP, and we will be doing that virtually to respect social distancing this year. So it'll be really interesting, it'll be really fun, and we hope you guys will still join us. So make sure you save those dates. Upcoming events that we have on our calendar here at Cornerstone, we have some webinars June 16th and 30th. We will be reviewing that new text to enroll feature on Medicare Center. So sign up for that on our website, cornerstoneseniormarketing.com/events. You can see all of the events on our calendar and register for them right there. June 25th, we will also be doing a Medicare 101 webinar with Kelly Myers. So if you have any questions about our value-added tools, you can always go to our website. Again, that is www.cornerstoneseniormarketing.com. We have lots of interesting stuff out there, stuff you may not be aware of that we are offering for our brokers. So take some time, go out there, and if you have any questions, you can always contact any of your sales or service reps. So without further ado, I would like to introduce Jeff Nasser. He will be reviewing the new CVS Ascendo Medicare Supplement product. We're excited to have him. Thank you so much for joining us, Jeff.
Thanks, Michelle. Good morning, everyone. I want to thank Michelle and Marilyn and Tim and everybody at the Cornerstone for helping me put this together. Give me 30 seconds here, guys, to share my screen and get everything set up. I guess I need to go back to the top of this. I guess you guys are muted. Michelle, and can you see this okay?
We got it, great.
Okay,
yeah.
Great. Thank you again, guys. I think the most exciting thing I heard Michelle say is the Cornerstone Roadshow is virtual. I don't know if you guys have, I know a lot of you guys go to the shows and you all might be in Toledo or go to Columbus or the Cincinnati or the Cleveland show, but when you're a rep, you go all 4 of them. So you go to 4 cities in 4 days. And I can't tell you, of all the shows I do and all the seminars and meetings, theirs is the most exhausting 4-day event that I've ever gone through. When you hit 4 cities in 4 days and you just have to go drive from one city to the next. So it's being virtual. I am very excited about that this year. I hope you guys can join because it always is a lot of fun. Okay, so today we're going to talk about the Ascendo Medicare Supplement. I'm going to go over the race a little bit. There's a Plan F strategy I would like to go over, just to describe some things and how we do things as a company at Aetna. Internal replacements, our new automated underwriting, and some tools and information that's on our website, just like Cornerstone's website, like on our website, that will help you basically increase business, make more sales. So I want to go through that towards the end. This should last about 35, 40 minutes at most. And like Michelle said, if you have questions, put them in the chat, and Michelle will ask me at the end of this presentation. or if you guys need to interrupt for something that's important, please feel free to do so as well, Michelle. Okay, as I said, I am the Regional Vice President for the East Region. I am located in Indiana. I am an Ohio State Buckeye fan because we do not have a reasonable football team here in Indiana, except for the Colts. And but for college, I'm definitely an Ohio State Buckeye fan. Since we got Michigan, Ohio State right there, and Indiana's kind of right in the middle of all that. Paul Erickson is our regional sales manager. He's down in Florida. I work with, and Colleen Tracer is the regional sales specialist. So if you see the right side of the map, and then the bottom on the right side, those are their phone numbers and email addresses. If you have day-to-day questions about applications, policies of Cornerstone, can't answer the questions for you, you need to contact the home office directly. Colleen's the person you want to talk to. If you call me or call Paul, we're just going to forward it on to her. So Colleen is our day-to-day person. She's been there forever. She came from agent services, so she knows all the insides and out of everything we do as a company. And that's her email address, tracerc2@aetna.com. If you happen to work with other agents or you have clients in other states, if you need to get a hold of somebody, we have a full team of our sales in different parts. There's 4 regional vice presidents, 4 regional sales managers, and 4 regional sales specialists throughout the country. This is our product availability chart. We put these out about every 6 weeks. This one's a little dated. It's April, and we have a new one out for June. But you get the gist of it. It basically, I call this the cheat sheet. It basically gives you everything you want to know about all our products. On the right side is the description of every product we have, a little summary about it, and this just gives you the highlights of the benefits. On the left side, if you do business in other states, it tells you what products are available in what state, gives you the household discount, it gives you the entities, any information you want to know about any given state. And as you can see, the reason I put this up here, because now it has the Ascendo as well on the product availability chart. Okay, so we rolled out Ascendo on March 13th in 15 states. And then April 24th, we rolled out an additional 5 states. And as you guys know, just recently, last week, a week from today, a week ago today, we rolled out Ohio, New Mexico, and Rhode Island. So we have now in, 23 states, and there will be more states coming. We do launches about every 6 weeks, as I said. The next one's coming July 16th. I believe it's Virginia and a couple other states that's going to be added on as well. Excuse me. This map, I'm waiting for the updated map, but it just shows you that where the states that are located. Ohio will be filled in once I get the updated map, but we also have it here in Indiana as well. I know a lot of you guys are on the border. If you're in Cleveland, we also have it in Pennsylvania. So there are other states right around you that we do have the Ascendo plan, and we'll be adding more states, like I said, as the year goes on. This is the brochure. Really just wanted to show you what it looked like more than anything else. It's virtual today with everything going on in this world. Most of our business is done online. It used to be 70% of our business was online through our e-app. Since this horrid COVID-19 thing has taken over, it is up to 95% of our business is now e-app. And when I get into this further, you'll understand why it's so easy to use the e-app if you're not using it, and the simplicity of it. Our plan has no pre-existing condition limitations. This is both on the Aetna and the CVS plan, the Ascendo plan. By law, every Medicare supplement must cover pre-existing conditions. However, you can put waiting periods on them, 3 months, 6 months, even up to a year. We don't. We cover pre-existing conditions from day one. And that's a big difference than our competition. If you're out there and you're competing on price and it's $1 here, $1 there, and you're looking for a reason why they might write Aetna, or you might get the client over someone else, this is a good reason. This is just basically standard stuff that everybody has a 12-month rate guarantee, 30-day free book. It's guarantee renewable. This woman must love popcorn. What I love about this photo is the children's playground in the background right next to the trash dump. Thought that was a real interesting picture they put on this. But it is what it is. The 12-month rate guarantee, I do want to point out, is a true 12-month rate guarantee. Again, if there's a little differences in programs out there, if someone is 67 years old today and they turn 68 3 months later, they could get a rate increase from a lot of their competitors right when the renewal turns, the next premium due date, that they'll get a rate increase because they've changed ages. We will never give anybody a rate increase except for at the renewal of their policy. So whether it's an age change, a renewal rate increase, whatever it might be, they always will have 12 months at that rate before they would see a rate change. Excuse me, I'm finding just a little bit of a sore throat. The basic differences between the two programs is the household discount. Most of our plans throughout the country on the Aetna side is 7%. On the Ascendo side, it's 14%. Unfortunately, Ohio has a unique law, and I'll show you that in a second. Normally, as long as 1 to 3 other people are living in a household, only one person on Ascendo needs to have the policy to get the 14% household discount. Ohio, in their wisdom, requires two people to be on the Ascendo policy to receive the discount. So if you have a husband and wife that are both on some other competitors out now, whether it be Aetna or somebody else, you're going to have to move them both to get the discount. Or if somebody's not eligible yet, and one is, you can give the one person the plan now. When the other person becomes eligible, they both at that point will get the 14% discount. Application fees, $5 difference. This is basically the wording on a household discount. I don't need to read all of this, but I really wanted just to point out Ohio is a little different. This is telling you that both people need to apply in what is considered a second person, your spouse, the civil union, domestic partner, or someone has resided with you in the past year. But that's in the second paragraph. In the first paragraph, it basically says both people must be covered under a Ascendo insurance company to obtain the household discount. Just giving everybody just 10 seconds to read that if they want to read any of it.
Hey, Jeff, I have a question for you. So
Sure.
reading that, it says that they both have to be on the Ascendo plan to get that household discount. Would there be an opportunity if you had a couple who one was on the Ascendo and the other was on the regular Aetna plan, would they be eligible for a household discount?
No.
Okay.
Not in Ohio. Unfortunately, Ohio's been very strict about this. In all other states, it is. In all other states, yes, but not in Ohio.
We had a question come up. They wanted to know what the application fee for the Ascendo plan was, and that was $25, correct?
Right. Yep. $25.
Thank you.
Okay. You're welcome. Okay. So there is no difference from your perspective on anything between the Aetna plan and the Ascendo plan. Your commissions are the same. No, just if you're contracted to sell Aetna, you're already contracted to sell Ascendo. No changes on internal replacement. I'm going to talk a little bit more about that. You're still under Cornerstone's hierarchy. It's available in the Quotes on the Go mobile app. If you're not using our mobile app, that's the very last slide I have. You definitely should be. It's a great tool to use. And once again, I talked about the Quote and Enroll, or e-application, how simple that is to use that as well. Okay, so one of the things in my agenda I had was the automated underwriting. This is something we've rolled out in the past few months. If you do an e-app, you will know within 5 minutes or less if your client is approved or not. You get 3 options. You'll either get a approved, a declined, or that, well, we need just a little more information. So there's a button that you will click on. If you look at the top right corner of this slide, you want to check auto underwriting. And as you click on that and you submit the application, we're either going to approve it, we've had to decline it, or it's routed to an underwriter because we need the medication that you put down just wasn't enough for us to make a decision right then and there. 80% are either approved and declined right then and there. And of that 80%, 80% is approved. So you're going to get all you got to do is refresh your browser and you will know if it's been approved or not. And this is version 1.0. version 2.0 will be out hopefully by AEP, where before you even submit the app, you're going to know if that person's been approved or not without even entering it, because we're going to be able to see the information as you're putting it in and know whether or not you should even submit it or not. Okay, our MACRA 2020 strategy. There are 2 buckets today. There's everybody that was on the plan before December 31st, 2019, and there's everybody on the plan January 1st, 2020 or later. Everybody that was on it before December 31st is always going to be eligible for Plan C and F and the high F. Our Plan F strategy has been this. There are 50 million people that are still eligible to buy a Plan F, okay? However, you got to think about who those people are. If they wanted to buy a Plan F today, if they're on a G, they're on a D, they're on a F, whatever it is, they wanted to buy another F today, they would have to go through underwriting to get the Plan F, because no newly eligible people can get it. Only people that have been on the plan before December 31st, as I stated. So you're going to get a very healthy book of business, because everybody that's applying will have to go through underwriting, and you can put up, and you can, I don't hate to say it like this, but you can cherry pick the healthier clients that you want to approve. So you're going to get nothing but underwritten business on the Plan F. So what we decided to do in 16 states is put out a very competitive Plan F rate, because we want as much business on Plan F as we can, because we know that's underwritten business and it's a healthier client. It's kind of weird. Aetna was always a Plan G company. A couple of years ago, we started migrating to Plan N because we saw the MACRA 2020 coming. So we start putting people on Plan N by putting out a competitive rate and increasing commissions on Plan N. You make about 5 points higher on a Plan N than you do a C, a G, or an F. So we went from a Plan G company to literally a Plan N and a Plan F company in the past couple of years. The reason I'm telling you all this is because when you look at rates in Ohio, again, I love the Ascendo program. We just happen to be really competitive in Ohio on the Aetna program. And if you look at the rates here, these are just a few examples I put together, and you can do this on CSG yourself. But I did a 70-year-old female on Plan F, and you can see Aetna, the CLI program, is $128, and with the household discounts, $119. Now the Ascendo is a few spaces down. It's a little bit more expensive at $137, but once you get to the household discount, it gets it down to $118 as well. So you can see that with the household discount, if you are insuring husband and wife, that you're still going to have as competitive as rate as you would the Aetna program. And I'm going to explain to you when I get through these rates why it might be a better idea to put somebody in Ascendo than Aetna. I'm just going to give you my thought process on this. Nothing that I can put in writing, or it's just definitely going to happen. But I'm just going to give you an idea of why. And then I looked at the Plan G and a Plan N for a female 65. Again, Aetna's CLI plan is the least expensive in the state. On Ascendo, we're a little more expensive. One thing about it, I will say about Ohio, it is very competitive. The companies are all within $10 of each other for 30 companies. It's just crazy how close everybody is. But once you apply the household discount again, you can see it gets to be one of the least expensive rates out there, both for male and female. Well, I guess you can see the female here on the G and the N, excuse me. So with the household discount, you're very competitive on the Ascendo rate. If anybody works the Indiana side of the business, if you're over in Dayton or whatever, I also did an Indiana rate just because that's where I'm located. We are not competitive here in Indiana on the CLI program, the Aetna program. It is not even close. It's not even listed here. You can't even see it in the top 40 companies. But you can see the Ascendo program on Aetna is one of the top 7 or 8 companies, and with the household discount is one of the least expensive, if not the least expensive, it looks like, than all companies out there. So if you do any business in Indiana, the Ascendo program is really strong for you. Now let me explain to you why, when I just showed you those rates, and you're like, well, Aetna's cheaper, a single individual, and then, well, even with the household discount, it's about the same price as the Aetna plan. So this is how the Medicare supplement market works. Whatever new business rate you have out there today, let's just use Indiana. the $123 rate. Let's say that Ascendo's been out there for years. Whoever's on the Ascendo plan over these years is paying the same rate as the new business rate. So if you've had a program out there, like I'm going to actually use Ohio. Let's use Ohio. CLI has been out there for about 3 years now. If we want to take a rate increase on our existing clients that are on CLI, we have to take an increase on new business rates as well, as long as that book of business is still open. Okay? Everybody has to be paying the same rate. The only way you can take rate increases for existing business only is if you close out that block of business and introduce a new entity. So that's why you see from time to time a new entity coming into a state, because healthcare costs go up, people age, you have to take rate increases, and that makes your new business rates more expensive and less competitive. So you close out an entity, you bring a new entity in, that way that book of business that's closed, you can take a rate increase just on them, and the new entity is all new business, and it's at a lower rate. This is not something just Aetna does, everybody does this. This is the way you keep yourself competitive in the marketplace. The reason I'm telling you all of this is because Ascendo doesn't have that existing book of business yet. So we're getting nothing but new business on the books today, and that will be like that for a while. So I'm not telling you, I can't guarantee it, I can't promise you this, but more than likely the rate increases on the Ascendo book of business are going to be less because there is no existing clients on that book right now. So if you're making a decision on which one to go and they're $1 apart, you might want to lean towards the Ascendo because a year or two down the road, it's probably going to be less expensive than the Aetna program would have been. Something we changed a little while back, I guess about 6 months ago, is now we're paying internal replacements at 90% first-year commissions. I think this has become more important with the Ascendo program out there. So if you've had somebody on the books for 7 or 8 years and you're earning a couple points commission and they're healthy enough to be rewritten on whether it be an Aetna plan or a Ascendo plan, we will revert it back to year one and pay you at 90% of first-year commissions. For obvious reasons, we weren't doing this, and a lot of business was leaving the doors because our competitors were, the agents were writing with our competitors because they weren't earning enough commission to keep them with us. They were rewriting it. Even if they rewrote it with us, we would only left them at that same level. If they were earning 2% and they rewrote it, they were staying at 2%. Now it reverts back to year one at 90% of what first-year commissions would have been. Okay, as we get towards the end of this, I'm going to talk a little bit about some information about in our tools. If you're not using our website, I urge you to sign up for it. I'm not bragging too much, but I've been told by far Aetna's website compared to the competition is by far the very best. There's two ways to get to it. You can either go from the Aetna homepage, or you can gain access where you see right below the second line there, aetnaseniorproducts.com. Either way will get you to our website. You put your username and password in and you log in. It will take you to the homepage, which basically you can see everything you want to do. I know this is not the easiest thing to read, but it will give you all the information you want to do. And if you want to do the quote enroll tool and practice, if you're not using it now, there's a sandbox. You go in there and you just play with it. You don't have to really put a real person in there. You can't send it to us, but you can do everything but submit it. And you can learn how to do the quote and enroll tool and how simple it really is to work. You can't screw anything up playing in the sandbox. This is the online application, and you can see this is highlighted where it says Medicare. So when you do a drop-down box, when you fill out the online app, you have two options. You're going to have the Medicare supplement for Aetna. Right below that one's going to be Ascendo, and you can click whichever one you want to market, which one you end up wanting to offer. We've added a new security question. No longer do you have to do a voice signature or an e-app signature. It's basically, you could be sitting in your office, your client could be sitting in their home, you're actually filling out the application online, asking them questions on the phone, or they've mailed you the app, or you, however you got it, and you're filling out the app online. Excuse me. You can ask one question. What is the first name of your pet? What is your first pet's name? and whatever they say. Mine was Mongo. You guys remember the old movie Blazing Saddles? So I would just put Mongo in, and that would be it. I wouldn't use the color because people forget what their favorite color is sometimes, and you might need a security question down the road. But it's so you type in first, name of your first pet, type in Mongo. That's like them signing it. You submit the application, and that's good enough for us now. It's like them signing the application. We can't make this any easier. This was all there before this whole COVID-19 thing was there. So it's become more and more valuable having all this information at your fingertips now. Like this webinar I'm doing right now with Cornerstone, we have others we do throughout the month. There's some of them that are live, some of them are upcoming. Whether you want to know about the DVH, whether you want to know about our recovery care, more about the Medicare supplement, our cancer program, we have webinars that are live, and we also have that are taped that you can just listen to at your leisure. As far as alerts, if you guys haven't done this, you should. You need to go to My Producer Profile, and you need to see what alerts you have turned on. If you're not getting certain emails from us, it's because you don't have your alerts turned on. So go to that page. I'm going to back up and show you where it is again. My Profile, My Producer Profile. And then you can click on the alert buttons, which ones you want on, which ones you want off. And that will help you obtain information on all your clients and everything going on at Aetna. As far as we send out e-bulletins as well. If you're not getting those, it's because you have that turned off. Producer guides, I know those are a boring thing to look at and read, but man, if you want to know anything about anything we do and how we do it, I'm telling you, it is in our producer guide. It's a very well put together piece of information. Yes, it's long. Yes, it has a lot of stuff in there, but it will give you everything you want to know. We also have flyers and ads you can print off and take them to a Kinko's or wherever and utilize them as you wish. Basically, it will autofill the information. You put your name, address, whatever you want to name in there. It will populate it. You can print those off, and you can do whatever you want with them if you want. If you do consumer mailings or ads or however you want to do it. Finally, whoops, oh, one more thing. Order supplies, easy enough to do. Click on the order supplies and download them, and they'll come right to your home or office. So the quote and enroll tool, the final thing I have on my presentation, if you guys aren't using this, you should. It's an easy app to download. It's called Quotes on the Go. If you type that in, just those words, you don't have to put the hyphens. You just type those words in. That's the only thing that will pop up. And you will be able to quote every policy we have, every program, whether it be a Medicare supplement for Aetna, the Ascendo, whatever it may be, the DVH, right there at your fingertips. And you don't have to log into the website. It doesn't require a login. You can do it in a matter of seconds. It's just a real easy tool to use. And I think that's all I have. So I will say thank you to everyone, and I will turn this back over to Michelle to see if anyone has any questions.
Thanks, Jeff. Yeah, we just have a couple of questions. So the first question is, what is the commission level for guaranteed issue members?
I'm listening. It varies by state, and I'm looking at my commission statement to see what it is in Ohio.
And then the next follow-up question to that is, when are members notified of the renewal rates?
60 days in advance.
Someone did ask, is there an Ohio rate sheet available? There is, and if you would like a copy of that, I can definitely send that out to you. You can just request it from me via email. My email is Michelle, michelle.kapp, K-A-P-P, @cornerstoneseniormarketing.com. If you just let me know you want a rate sheet, I can get that over to you. That's no problem.
Unfortunately, let's see, Ohio guarantee issue. Wow, that's really low. It's 0.8%, less than 1%, I should say, just less than 1%.
sorry, I was answering I was typing in an answer for somebody. So you said that the commission level for guaranteed issue,
It's only 0.08%, so it's less than 1%. That's the state requirement. They tell us what we can pay, and we have to go by their guidelines.
okay. And they wanted to confirm, when are members notified of the renewal rate?
60 days in advance.
Okay. And then, so we have a broker who's asking, how long do you estimate before Ascendo closes its first book?
I can't answer that as far as giving you exact time, but we usually keep a book open about 4 to 5 years on average.
Okay. So we have a question, and the question was, if someone voluntarily terminates their employer retirement plan, can they get guaranteed issue for Plan F? There have been inconsistencies between companies when someone voluntarily versus involuntarily terminates an employer plan.
And the way I understand it and the way Aetna understands it, because they voluntarily get away with it, they can buy a Plan F, but they will have to go through underwriting. It's not going to be guarantee issue.
Okay. So then we have a question here from Jackie Green. The question was, how did you get rates for all the carriers on one slide? I don't know if you know this, but you can check rates for all carriers on our CSG quoting tool on our website. You can put in a customer's demographics and it will show all available options and their rates for that person's specific information, age, gender, and zip code.
The way we do it for our side is that's just an internal program we have. It's a system to help us keep track of our competition and how we compare to the rates, to be honest with you.
And then they wanted to know, are there lifetime commissions available?
Let me look at it in Ohio again. Like I said, if you guys have not, our commission statement, you guys get to see, but you see it for mostly for Ohio. If you know, every state is so different about how they do it. I'm going to look at Ohio for you as I talk. Hold on. No, Ohio is commissioned for 7 years.
Yeah, that's standard. I apologize. So can we learn to run the rates for all carriers? Yes, if you would like to review how to run rates for all carriers, we do have some webinars that have been pre-recorded using our CSG quoting tool. I also am available to review that one-on-one with any broker who would like to schedule that with me or one of your other preferred reps here at Cornerstone. They can do that with you. And I did type out my email address in the question and answer panel, but I will spell it again because it was requested here. My email address is michelle.kapp, that's MICHELLE.KAPP @cornerstoneseniormarketing.com. And yes, you did hear correctly that guaranteed issue is going to be less than 1% commission. And then they were wondering, what is the commission for initial enrollment at age 65?
For guarantee issue or for anybody?
For anybody who's turning 65.
In Ohio, first 7-year commissions are 20% level for 7 years, and Plan N is 25%.
Okay, thank you, Jeff, for verifying that. So we have a question about the CSG tool, about whether or not it prints out the way that he had it on the slide. It does not print out like that. You can print out a comparison for 3 carriers that you would like to look at. Or, I mean, if you go out there and you want to have a way to see all of them, that would be extensive, but you could, you know, snip screen it but I mean, there's nothing that
Yeah,
has it the way we had it.
yeah. That's something we call Tableau, and it's a program that we subscribe to that lists everything in there. This is an internal system we have. You guys cannot. I would love to send it to you if I could. It's just impossible for it to leave at the end of the system.
Yeah, it is pretty nice, Jeff. So we have a couple more questions on the other pane that came up. If someone voluntarily terminates their employer retirement plan, can they get guaranteed issue for Plan F?
No.
And why is there an application fee, and when must that be paid by the insured?
It's built into the first premium notice, so it's going to be right then and there. When you calculate the premium on the online app, it'll add the $20 or $25, and it's really just to cover administration costs.
Yeah, that's pretty. There are many of those, many applications that do have that same $25 fee. And then the last question is, does Indiana have lifetime renewal?
No, we just changed that a few years back. Indiana, let's see, let me look at it. I'm going to pull it up real quick before I speak out of turn. Indiana is, no, they made us take, I remember this just like a year and a half ago. They made us take renewal commissions away. So it's for 6 years, 22% for all plans. But we also have to pay 22% on guarantee issue.
Okay, we have one last question here that has come up, and that is, I've been told in the past that Ohio is a voluntary state. If they leave an employer plan, oh gosh. Sorry, I got another question that moved it up. If they leave an employer plan, I've been told in the past that Ohio is a voluntary state if they leave an employer plan. Has that changed? Is this just for the F plan?
To tell you what, I'm not going to, there are laws that are different by state on voluntary and involuntary. Yeah. So I'm not going to put my foot in my mouth and give you guys the wrong information. What I will do is I will research this and I will email Michelle. And Michelle, whoever's asking you that question, or if a lot of people want to know, you can just let them know.
I was actually just thinking that this may be something that I should review separately on maybe in a different webinar. With the Medicare 101 that's coming up, maybe these are questions that we could address in that webinar with Kelly later this month, because that's a good question, and it is, it does vary by state. So we'll address that, and I can get more of those answers for you guys. So the last question, which I think is a good question for you, Jeff, is, does Aetna and Ascendo have gym memberships? And if so, what is it?
We do not. And as you can tell by our rates, that we're very competitive in Ohio and a lot of states. And our business numbers our business numbers are through the roof, to be honest with you. One of the reasons is by not putting that gym membership on there, it helps us keep the rates lower, because the way those work, everybody has to pay for it. So if we were raising rates because we have the gym memberships about $2 to $3 per person to put that on there, to add those benefits on there. However, we have found out through research that only 10% of the people actually use it. So we made a determination that we'd rather keep the rate lower than add the gym membership and raise the rates.
I see. Okay, that's great. So if you guys have any other questions, please feel free to reach out to your service rep. I'm sure that you are familiar with Lyle Solomley, Lisa Van Such, Kelly Myers, Patrick Wiley, Jim Meyer, and you can reach out to them anytime, or your sales rep. We're all here to answer your questions anytime. So I think with that, we'll wrap this up. Thank you so much, Jeff, for taking time.
Thank you,
to
everyone.
do that.
You're welcome.
Yeah.
Thank you. Thank you, guys, for taking the time to listen. And I really appreciate it. Thank you, Michelle.
Yep.
Thank you. Tell Tim and Marilyn I said thank you, and I love working with you guys. Take care.
Yeah, we love working with you too. Thanks, Jeff. Thanks, everybody, for jumping on with us. We're here to help anytime. Thank you.